Next time you go to the doctor, you might find they have some different advice about preventing heart attack and stroke. Under new guidelines released today, aspirin won't be recommended for healthy people, and all risk factors will be taken into account when considering whether or not you need medication. Medical reporter Sophie Scott has the story.
Dom Mano is like many others in their 40s. He's got slightly elevated cholesterol and blood pressure and is carrying a little extra weight. Normally his GP would put him on medication, but not under new Australian guidelines.
We allocated 3 months for me to lose a little weight and modify my food and diet intake. Try to lower the fatty foods, try to lower the salt, and then increase my activity levels for exercise, and possibly try and lose 5 to 10 kilos, and we'll revisit it in 3 months.
New guidelines put out by Australia's top health experts recommend significant changes in how to prevent heart attacks and stroke in people aged over 45.
Well, the big difference will be that the doctor will take a more holistic approach to assessing what kind of intervention they need to take for preventing heart disease.
GPs will look at a full range of risk factors such as blood pressure, cholesterol, age, weight and whether the patient smokes. While high-risk patients will be offered medication, low-risk patients will be encouraged to adopt a healthy lifestyle, with doctors encouraged to offer more than just a few words of advice.
As your risk increases, we ought to be offering more intensive interventions, and that may mean seeing a dietitian or an exercise program.
And aspirin will no longer be recommended to prevent heart attack and stroke. Doctors saying that the risk of stomach bleeding outweighs the benefits for healthy people. The guidelines are voluntary, but health experts hope they'll be embraced and that more patients will get more appropriate treatment. Sophie Scott, ABC News.